Hi, my name is Shirley Morgan, and this is my intervention presentation and capstone video reflection for NUR-FPX 4900. Anxiety is a feeling of fear or dread, representing your body's natural response to stress. National Library of Medicine, no date. Everyone experiences anxiety at some point in their lives, yet many individuals struggle with anxiety disorders. With an anxiety disorder, feelings of dread become excessive and persistent, leading to irrational fears and disruptions in daily life. As mentioned earlier, anxiety is our body's natural response to stress and can manifest as a racing heart, sweating, brain fog, and feelings of unease. Experiencing normal anxiety can motivate us. However, some people may face persistent anxiety, which can lead to more cognitive and behavioral symptoms. Anxiety disorders are the most common mental health condition globally. World Health Organization 2023. Those dealing with persistent anxiety and anxiety disorders often struggle with the effects on their personal relationships, careers, social lives, and overall mental health. Many individuals diagnosed with an anxiety disorder are later diagnosed with depression, as these two conditions frequently occur together. My sister Caitlin has struggled with anxiety for many years. In the early years following her diagnosis, she faced significant challenges, and as her older sister, I witnessed it all. There were days when her anxiety was debilitating, preventing her from leaving our home. As she grew older and started new treatments, her anxiety became more manageable, allowing her to live her daily life more coherently. When I began my Capstone project, I knew I wanted to explore a topic that personally affected me to gain a deeper understanding of the condition and advance my nursing career in this area. Caitlin was a willing participant in my interviews and was very open about how her anxiety has changed her life since her diagnosis. From our interviews, I started working on creating a brochure for her about anxiety that she could take with her and use in various situations. My brochure included symptoms of anxiety, complications related to the long-term effects of untreated anxiety, the social determinants of anxiety, online resources available such as treatment options including telehealth, and other resources and hotline numbers she could reach out to, providing the numbers for these hotlines on the brochure. I met with Caitlin on February 8th to show her my completed brochure and explained its contents. We gathered at her home in her home office, which provided a quiet setting for our discussion. I spent 3 hours with Caitlin reviewing the brochure, considering how she can incorporate it into her daily life, and explaining how to access the resources I included. No additional instructions were necessary for my intervention, as I provided the phone numbers and links directly on the brochure for easy access. Caitlin can take this brochure with her and reference it as needed. The brochure can be converted into a file on her computer, allowing her to share with others who may need these additional resources. During one of my previous meetings with Caitlin, we discussed how she can attend local support groups for those with anxiety in her new area to connect with others experiencing the same condition. When I presented my brochure to her, she shared that she would love to show it to those in her support group, as it contains various resources available for individuals 24/7. The brochure is easy to read and visually engages the reader with its artwork. After I educated Caitlin about the brochure, I asked her for her feedback on how to improve it for those with anxiety. She informed me that the contents of the brochure are excellent for individuals who are newly diagnosed with anxiety, as it helps them recognize the symptoms of the condition. Additionally, she noted that providing online resources and national and international hotlines is valuable support for anyone experiencing overwhelming anxiety who cannot see their usual provider. While it will be challenging for me to determine the actual effect the brochure has on Caitlin and her anxiety, I can reach out to her in the next 3 months to research whether she has used the brochure or if she has shared it with anyone else along with its resources. This will help me evaluate how effective creating a brochure was in helping individuals access information regarding the condition and available resources for everyone. Technology presents both benefits and drawbacks for those living with anxiety. With advancements in technology, individuals managing anxiety can access vital online resources including digital therapists, messaging apps, and comprehensive information about their condition. Numerous online platforms such as medical journals and blogs enable people to gather insights and seek support. Many individuals experiencing anxiety often feel isolated, but technology offers a range of video chat platforms and social media that facilitates connections among people. As mentioned earlier, technology creates opportunities for telehealth, allowing individuals to consult with mental health professionals from the comfort of their homes. In my brochure, I aim to include technology resources available to everyone. I covered telehealth options in my brochure, highlighting how mental health nurse practitioners provide telehealth services, enabling patients to see via phone. You can access online therapy sessions, medication refill services, and condition monitoring. How do I use telehealth for behavioral health care? 2025. I also included other online resources like the NAMI website, which offers a wealth of information to individuals. While researching for my intervention, I continued to use the CRAP method to ensure that all my evidence-based research was current and reliable. I utilized peer-reviewed articles and focused solely on evidence-based research from the past 5 years. This approach guaranteed that all the information I incorporated into my brochure was both current and trustworthy regarding anxiety. When creating my brochure, I wanted to ensure there were free resources available because Caitlin and I had previously discussed how her copays for medication could put a financial strain on her. We also talked about the Affordable Care Act and how she might benefit from this government resource, which I kept in mind while developing my intervention. As a baccalaureate-prepared nurse, when I educate my patients about treatment options or resources, I want to ensure they have all the necessary means to choose whichever option they prefer. I believe my brochure represents best practice as it contains all the necessary resources for individuals to educate themselves on symptoms, treatment options, and available support. While Caitlin has been undergoing her current pharmacological treatment for many years, she was open to researching new alternatives, and my brochure offers many options for her to explore. All individuals can benefit from my brochure. There is a significant chance that you or someone you know is affected by anxiety, and this brochure would be a valuable resource for them, especially if they are in the early stages of diagnosis. Everyone with anxiety experiences symptoms differently and requires various treatment options. My brochure provides resources for everyone, and they are encouraged to research them at their discretion. I believe this brochure will help Caitlin with her anxiety. This project has greatly advanced my education regarding how anxiety affects people, and I will continue to apply what I've learned from it in my nursing practice. Throughout this Capstone project, I have evaluated the type of care I currently provide as a nurse. While researching for this project, my understanding of nursing ethics and standards has grown tremendously, and I will continue to apply the Code of Ethics to every aspect of my nursing practice. Nursing standards are crucial when caring for patients with anxiety. As nurses, we must communicate effectively with these patients and build a trusting relationship so they feel comfortable sharing their feelings. Establishing this relationship allows our patients to express their thoughts, inform us when they need additional care, and take their medication as needed for their anxiety. Nursing ethics guide my care for each patient, especially those with anxiety. I will collaborate with them to determine which resources they wish to use while consistently maintaining my patient's autonomy. Patients with anxiety often struggle to trust anyone, particularly providers involved in their care, so it is vital to preserve our patients' trust and keep their best interest in mind. Through this project, I have enhanced my communication and collaboration skills, learning about various leadership styles and which are necessary for different scenarios. As a nurse, it is essential to communicate openly with our patients, providers, and everyone else involved in their care. Best practices for maintaining open communication include asking open-ended questions and practicing active listening, enabling patients to feel comfortable raising concerns and questions they may not have previously expressed. ALU 2024. Applying these best practices in my conversations with Caitlin helped us explore her feelings about anxiety and how her job and financial situation influence the treatment she receives. I designed my educational brochure based on our discussions during the interviews, making it more patient-centered for her. I have improved my ability to work effectively as a team, as Caitlin and I needed to coordinate our schedules to find mutually convenient times for our interviews and discussions. While obtaining my bachelor's degree and working on my capstone project, my understanding of nursing care in general and the roles of a baccalaureate prepared nurse has grown tremendously. I will continue to apply this new knowledge into my practice and improve the care my patients receive. Thank you.